Darla Dale, and I'm a registered dental hygienist and a registered dental hygienist in alternative practice. I keep both licenses, and I work in mostly Eureka, California, but also up in Crescent City. And the settings that I'm in are multiple residential care facilities where special needs patients reside. I also have my own office, which I just opened recently, and I do a lot of hospital dentistry. Coordinate that and actually assist the cases and kind of case manage those patients and then follow up with them afterwards. Oh gosh, about 17 years ago, the Redwood Coast Regional Center, which is part of the Regional Center System, was looking for a dental coordinator to come on board and help with the special needs populations. And I wanted to do something different than just sitting 9 to 5 in a dental office every day for the rest of my life. I just didn't see myself doing that. So when the opportunity became available, I went to speak with UOP. That's who came and presented the idea of going out into the community and helping with the special needs populations, because there's a huge unmet need. And it just fit for me. It was a great opportunity, and I've been with them ever since, 17 years. Most of them would end up in the emergency room. A lot of times, even the support just from being the dental coordinator, arranging their dental appointments, making sure that they get to their dental appointments, and even just physically setting up their appointments for them and making sure that the care providers that provide transportation know when the appointment date and time is. And if I weren't there, it just wouldn't happen. They would just be sitting there 5 and 6 years. Most of my patients have gone 5, 6, 10 years without any dental care whatsoever. And so when I get them, it's usually they haven't been seen and are not in a dental home, and that's what our goal is to try to get everybody reestablished into a dental home. A typical day is, it's kind of crazy. Depending on which side I'm doing. If I'm in my office, it runs pretty smooth because I do have an assistant that helps me bring the patients in and collect the paperwork from them and enter the information to the computer, and it goes pretty smooth unless the technology is not working well that day, which sometimes happens. So the VDH sites can sometimes be interesting, especially when I'm in a home. I've gone into a home and done an entire family, and you have one child screaming and crying, and then the mom's trying to assist to become a new dental assistant, which has gone really great with her 3-year-old when she has a new 6-month-old baby, and then there's a 7-year-old little girl crying because she wants a sucker. And so it depends on the environment. It really does. Depends on where I'm at, the setting for the day, because I do so many different settings. The biggest success, I think, is being able to provide the extra services that I haven't been able to provide, and that would be the preventative fillings for the patients. I think that that's a major benefit for these patients. They're just not able to get into the clinic, and the clinic availability is really limited, and typically they are only doing a little bit of dentistry at a time, where we are not providing anesthesia and we're not picking up a handpiece, and so we're able to provide those temporary fillings for patients in a much less traumatic situation for them, and so they're able to kind of accept the care a little bit better. And I think that a lot of them wouldn't tolerate any kind of filling or any kind of care if they knew that local anesthesia and the handpiece was involved. So these special needs patients, we're providing a service that I don't think they would get otherwise. And the biggest challenge for the VDH project, I think, is being in the rural setting that I'm in. Sometimes technology is a challenge. Things not working properly, internet connections sometimes failing. We've had some issues up in Northern California where the fiber optic lines have been cut a couple of times, and that shuts everybody down, including the clinics and the medical offices. So I'm not alone in struggling with technology in a rural area. I think my interactions with my patients, I get along really well with my special needs populations, my geriatric patients, and I think my reward is feeling that I'm making a difference for them. And it's just the best part of my job. It's just that kind of interaction and that relationship I have with my patients I'm pretty proud of it, actually. I have one recently that was pretty amazing to me. I've been working with an adult for probably 10 years now that has pretty profound autism, and he has always been hospitalized for his care. For over the past 10 years, every couple of years we've had to take him in just to clean his teeth and take x-rays and do an exam on him. He's always been hospitalized. And when I finally opened my own office this last January, I decided it was time to give him the opportunity to see if he could do dentistry in a clinical setting versus constantly just automatically going to the hospital setting, which is always what was done. And so last week he came into my office and we had a great visit. I cleaned and actually scaled his teeth. He had a lot of subgingival calculus. Scaled his teeth and was able to place a temporary filling in one of his teeth. The filling had come out that was placed previously in the hospital. And rather than trying to set him up emergently into the hospital setting, which takes sometimes up to 6 months, I was able to provide all his care right there in the office, and he did wonderfully. Everybody was amazed at how well he did. And so from now on, we'll be doing all his preventative care in the office rather than going right to the hospital setting. So that was a great thing.